So in this question, we have a young female. She is 28 years old. She has some vaginal spotting. So immediately, I think age is very important here because if this was a much older patient, let's say postmenopausal, and she was having some vaginal bleeding, I would be a little bit more concerned of some sort of cancer or malignancy, particularly endometrial cancer. Now, this is a younger patient, and so it could be physiologic, it could be a lot of things. Now, she's normally had, regular menses, so this tells me that this is some sort of acute change. This is not, PCOS or something that's kind of ongoing. She used to have normalcy in her cycle, and she no longer has that. Now, this has been going on for the past 2 days, and her last menstrual period was 6 weeks ago. So now I'm definitely thinking, hey, is this pregnancy? What is causing this? When you look a little bit deeper, now the patient's beta-HCG is elevated. It's not super high. At 6 weeks, we would expect this to be, much greater than 1,000, but it's currently sitting at 800, and 2 days later, it just goes up just slightly to 900. Now, in a normal pregnancy, after 2 days or 48 hours, the beta-HCG should go up. It should pretty much double. And here we know that this is not a normal pregnancy. Now, pelvic ultrasound shows no gestational sac, which tells me that this could definitely be some sort of pregnancy process, but there's no gestational sac in the uterus. So it's not a normal pregnancy, which is, supported by the lack of beta-HCG going as high as it should after 2 days, as well as not being high enough in the first place at 6 weeks gestation. So we look at answer A, where you have atypical endometrial cells, which tells me there's some sort of dysplasia happening, disorganized glands, which tells me there's some sort of disruption of the architecture, and then multiple mitoses, which means there's rapid replication of these cells. To me, those three things point directly towards malignancy, specifically an adenocarcinoma of the endometrium. Now, I don't think that's the answer, so we've crossed it out here. We move on. Dilated coiled endometrial glands. So that's typically seen in pregnancy, and in this patient who does have an elevated beta-HCG, has not had a menstrual period for about 6 weeks now. Pregnancy is definitely in the picture, but it's not a normal gestational pregnancy. This patient has to have a gestational sac somewhere outside of the uterus, since ultrasound showed that there's no gestation in the uterus. So this could potentially be an ectopic pregnancy. We move on to letter C, inflammatory infiltrates of the endometrial glands. Now, this is an either inflammatory or infectious process, potentially endometritis. But in this patient, she doesn't have a fever. Her vital signs are completely normal, and she hasn't talked about pain. She hasn't had pain with urination. She hasn't had pain with menstruation. She just hasn't had pain in that area, which would typically be a little bit more indicative of an infectious or inflammatory process. There also wouldn't be an elevated beta-HCG if this was an infectious or inflammatory process. And finally, we have straight, short endometrial glands and compact stroma. Now, that is typically more indicative of the early phase of menstruation, specifically the proliferative phase, which happens about 4 to 7 days after menses, and it's right prior to ovulation. Now, this patient hasn't had menses in 6 weeks. She has an elevated beta-HCG, so there's something going on that's not just regular menstruation. And so here, B would be the best answer.